Here's an update now on the issue around vaccines in this country. 1 million doses, you'll remember, of the Oxford AstraZeneca vaccine arrived 2 weeks ago. The rollout of those shots was put on hold after it was discovered they were not effective enough against the variant first discovered in this country. Let's get the latest from the South African Medical Association's Angelique Coetzee on the J&J vaccines that are expected. Dr. Coetzee, I think it would be an understatement to say this issue of the vaccines doses from Johnson & Johnson arriving is a matter of urgency. It would be an understatement to say that, because it's becoming clear that this possibly will be one of our lead vaccines in the fight against COVID-19. In your engagements with various stakeholders, what is your understanding of how far we are from actually receiving these doses in the country?
Good morning to all your viewers out there. I'm smiling today because the vaccines is going to arrive today, and the vaccine rollout program under National Department of Health and MRC will commence tomorrow morning. So the first 80,000 dosages is expected later on this morning, and the rollout will include 2/3 to the public sector, 1/3 to the private sector. There is clinics or hospitals per province already identified, as this is under a section, as Helen Rees also said before, section under phase 3B rollout. It must be overseen by MRC. So in the Eastern Cape, it will be Livingston and Nelson Mandela Hospital. Free State, it will be Pelenomi and Universitas Hospital. Gauteng, Baragwana, Steve Biko. KwaZulu-Natal will be Albert Lutuli and Prince Mshini. And in Limpopo, Pietersburg and Mankweng and Mpumalanga, Rob Ferreira, Witbank, Klerksdorp, Northwest and Job Simankana Tabani Hospital. And then Northern Cape, Robert Sobukwe Hospital, Groote Schuur and Tygerberg is the other hospitals that will be the vaccination sites. So that starts tomorrow, and we are also very glad and happy to announce that under the leadership of SAMA and the Unity Forum of Family Practitioners, consisting of IPAs and SAMDP and also the Western Cape doctors, that we have made sure that the general practitioners in private practice over the next 2 Sundays will be able to go and vaccinate for those that would like to at these sites closest to them. And I'm so glad that you actually asked me, because we need to get the message out for the general private practitioners that they must register on both systems, as the one validates the others. Then for all the healthcare workers, everyone must register on the EVDS system, as well as the GPs on HTTPS vaccine.enrollhealth.gov.za. And then we will also ask the GPs, you need to vaccinate, you need to register on that website, as well on for vaccines for healthcare.co.za. So if you have been registered on both of these two, we will then be able to give you a time slot, especially to the GPs, because there's only 2 Sundays open on the first rollout. As the process progresses going further and forward, and once if the vaccine is being labeled under section or being guaranteed under section 21, then more sites will become available. But for now, it is extremely important that we get our GPs and our other healthcare workers, specialists, hospitals, vaccinate as quickly as possible.
So, Dr. Coetzee, because of the false start that we had with the Oxford AstraZeneca situation, when those doses arrived at the airport and we had a glimmer of hope that we could get our vaccination program underway in earnest, you will understand that, some of us are not so quick to smile as you are smiling, but from the level of detail that you've outlined, including the rollout itself that you say will start tomorrow, as well as the 2 Sundays that you're saying are dedicated to GPs in private practice, this is solid information that you have on good authority that the vaccines arrive in the country today.
Yes, solid information. And so the South African Medical Research Council, or MRC, they will be coordinating the rollout of the Johnson & Johnson vaccines. And those hospitals that we have set or named, they are specific SAMRC facilities that will be oversee and overlook this going forward. So this is a joint venture by MRC as well as National Department of Health. And this time it's going to work. I promise you, you will see tomorrow the vaccines will start to be rolling out.
Thank you for sharing the good news with us, Dr. Angelique Coetzee from the South African Medical Association. Of course, the stakes are high for them, just as high, if not even higher, because it's their members who are at the front lines and at the forefront of responding to the COVID-19 situation. So when they give us information, we take it really seriously. So you're seeing there at the bottom of your screen, it's the breaking news. You heard it here first, that the South African Medical Association telling us that the vaccines from Johnson & Johnson, the first 80,000 doses will be arriving, and Dr. Angelique Coetzee telling us that the vaccination program will actually get underway tomorrow, encouraging healthcare workers to head on over to the portal that is for registration, for them to register to receive that vaccine as soon as it's being rolled out. So let's see as the day progresses what we'll be hearing from official sources. But that's our information at the moment. Today is the day.